Welcome to this special edition of Futuris, in which we'll look at what Europe is doing to tackle some of the biggest challenges of our time. The initiative, part of the Horizon Europe programme, has 5 goals. Fighting cancer, building climate-neutral cities, protecting our seas and soils, and our focus this week, adaptation to climate change. We spoke to the mission's head, Connie Hedegaard, to find out more about what the initiative seeks to achieve.
The meaning is that no matter how much we do on mitigation in Europe, we will also have to adapt to climate change. And how will that impact our municipalities, our cities, our societies, our businesses, our homes? How could we make Europe a more resilient place? And how can we do it in a manner that benefits the economy, that is good for people, that is good for business, and where we also try to help each other a bit, shortcut to better solutions by cooperating, by working together, and by sharing each other's data, among other things.
What's the strategic approach behind such an ambitious and wide-ranging plan?
This huge endeavor, you can sort of attack in many, many different ways. We have said, why don't we try to identify 200 regions in Europe with very different challenges, with different experiences, different practices, some good, some not so good, that others could learn from what to do and maybe also what not to do. Then we could identify where do we have some strengths, but also where are there some gaps knowledge-wise, where we need, for instance, our scientists to come up with new solutions or our companies to come up with new technologies. And the other thing is we want to make 100 deep demonstration projects out in 100 regions where we really try to make new technology work to show how could this be done. And then, of course, the whole aim is that afterwards we should inspire each other. We should build on each other's experiences instead of each of us reinventing the wheel.
One of the major challenges connected to climate change adaptation concerns our health. We went to Norway and Greece to meet the scientists from the so-called exhaustion project. They're studying what impact rising temperatures and air pollution have on medical conditions. Rising temperatures increase the likelihood of heat waves and wildfires. Experts think that this climate effect, combined with air pollution, represents a major risk to human health. Around 90% of the global population breathe polluted air. It's estimated air pollution causes 7 million premature deaths worldwide every year. The EU-funded Exhaustion project focuses on the link between heat, pollution and cardiopulmonary diseases. Scientists at the Centre for International Climate Research based in Oslo are attempting to develop models that will lead to effective adaptation policies.
Currently, air pollution is the largest killer in Europe when it comes to environmental stressors. But the fact is that global warming can actually amplify the damages related to air pollution. And that can happen in many ways. One thing is that increasing temperatures can actually lead to increased emissions of air pollutants and increased concentrations.
The project will also examine the role different socio-economic conditions play in a changing climate. For example, how the geographic or demographic makeup of a location might affect the health of local populations. Studies already show a direct link between disease and rising temperatures.
We have identified several factors that are associated with an increased for myocardial infarction, such as air pollution with carbon monoxide, sulfuric dioxide, nitric dioxide, but also the temperature, as I said. But what we do think is that the combination of those two, for example, an elevated monoxide together with a high temperature, that might be the worst case scenario.
The Earth is around 1 degree warmer than pre-industrial levels. It means extreme weather events will be more likely in the future, even if governments stick to the 2-degree global temperature rise that was agreed in Paris in 2016. Even this increase is expected to have significant repercussions for human health.
We still committed to a certain level of increase in heat waves, and they will impact us, and it will not be as what we used to before. I mean, the summers that we have had, they will be different. We have committed to a certain level of warming. We have committed that heat waves will be more frequent and more intense, and that will have health impacts, and we need to be prepared for that.
Specific climate conditions in different parts of the world will also play a major role on public health. In this situation, the ability to adapt to rising temperatures becomes crucial. The project's Greek researchers are examining how different populations might react when exposed to rising temperatures.
We know that the lowest mortality temperature in the Mediterranean countries is about 29 degrees Celsius, and in central northern European countries, it's about 23 degrees Celsius. So there is a difference. The population reacts differently to specific temperatures. Also, cold effects are higher in Mediterranean countries because the population is not adapted. And as I said again, the adaptation does not need to be physiological adaptation. It can be behavioral adaptation. So we don't expect cold weather. We don't have the protective means to mitigate its effects.
A key question scientists in Oslo are trying to answer is how people might adapt long-term to a temperature rise of a few degrees. Their findings should help develop adaptation strategies to limit deaths and disease in vulnerable groups.
It's not likely that the quantitative relationship between heat stress and mortality that we have had historically will continue in the future. Or at least we don't know that. It could well be that societies adapt. As I say, there are different adaptation measures you could think of. Building greener cities to avoid the urban heat island effect, implementing alert systems, etc. There are many things that can happen that will actually reduce the vulnerability in the European populations in the future.
That's all for now. Thanks for watching. For more on what the European Union is doing to tackle the major challenges of our times, head to Futuris' webpage and our social media networks.